Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. And your calls at 866-870-5752. That's 866-870-5752. And right now we're speaking with Robert.
Hey, Robert, Dr. Marc Darrow and Dr. Thomas Grove. So I think you got an earful about your friend who had the surgery that we think probably shouldn't have been done, but that's, we weren't there. Maybe the surgeon made the right decision, maybe he didn't. But the end point today is it sounds like your friend can be healed with stem cells or platelets, PRP. And if you want to get to the office, the phone number there is 800-300-9300. Hang on with us, Robert. I want to see, is Freda still with us on the phone?
Frida and Simi, yeah.
She's still there?
Yeah.
Okay.
She's waiting for you.
Okay, good. So, Robert, do you have any other questions about this? I think we've told you everything there is to know about surgeries for necks and backs.
I appreciate the information. I want to look at your information, your book, and your videos.
Good. And the website's a good way to look. You can watch me doing videos. On videos, you can watch me injecting necks, or most parts of the body. With Dr. Grove's skill with ultrasound, he can now inject things that I would never do before, because he can actually, he's one of the world's experts really in ultrasound-guided needle injections and diagnostics. So,
do you also have a comprehensive kind of wellness approach? Because just doing injections, I assume that there's more involved than that to help these stem cells. I don't know how a stem cell helps.
Robert, it's pretty simple. The injections do the job. There are other things that we can tailor for a certain patients, but it's not something really to go over at this time. We have to examine your friend and see what's going on. And
can you just say how long, given what I've told you, I know it'd be hard to say, but how long it takes for someone to find results?
Sure. Yeah. I can tell you myself, I was a gymnast. I fell on my head every day. I had terrible neck pain. I've had pain all over my body, to be honest with you. I'm 75, but in my day, I was a crazy, I'll call it myself, stupid athlete, because I did stuff that I knew I'd get hurt, but I didn't care. And even today, I still sprint and injure myself doing that, playing golf. I can injure myself doing anything because I love feeling my body being stressed. And I'm not happy unless I get a really hard workout. I won't just do something gently. So I've had tons of injuries. I've injected my own knees, shoulders, elbows, wrist. I've had other people do my neck and back. And for my experience, I'm a very fast healer. I've healed overnight on most of these areas. I had one stubborn shoulder that took a few months to heal. So I think you're getting the idea. We don't know when. It's different for everybody. Everybody's pathology is different, and everybody's use of their body after the injection is different, meaning that some people don't listen to us. They're overly active, and they're not going to let it heal. These cells have to grow in. It's not like a magical cure, and it's not like a cortisone shot with lidocaine where you get the shot and you feel great because it's a cover-up. That's a Band-Aid. It's numbing it up. This is actually healing the area. So it can take a while or it can be quick. It just depends. We don't have the answer. Everybody is different. And God bless you, Robert, for calling in. We're going to go to either Frida or Freda. Which is it, Frida or Freda? Are you with us?
Is it Frida or Freda? Are you there?
You say potato, I say potato.
Well, we'll figure it out.
Well, I'm gonna talk about.
Are you with us from Simi Valley?
I'm gonna talk, Nita.
Okay.
So, Freda or Frida called in about her knee, her second toe, and her left foot. I don't know if she's still listening, but I hope she is, because that's a lot of a lot of things for us to talk about. Knees generally, most people that we see have meniscal tears, even if they don't have pain in their knee. So, sometimes we check out the body. Someone comes with a hip, we'll happen to take a look at the knee, and we'll see a meniscal tear. I have meniscal tears, medial meniscal tears in both my knees. I have no pain. So I'm going to guess, Frida is either cat got her tongue or she can't hear me, has knee pain. It doesn't matter what she's been diagnosed with. That's the thing that's so important. It matters where we touch and when we move her around, where we find the pain generator. So it could be a meniscal tear, it could be a medial collateral ligament tear, it could be a patellar tendonitis, it could be a quadriceps tear, it could be all of these different things, and usually we can heal all of them with platelets or stem cells. And that's a decision that we make with the patient. We let the patients decide what they want to do. We don't push people. We give them our advice, and we often even send them out for a surgical consult with an orthopedic surgeon just to make sure that there's no real mistakes going on. And then the second toe, that could be something that is neurological. It could be something that is mechanical, and we'd have to touch that area to find out. Oftentimes when I find that people come in and they say they have a Dr. Grove, what is the syndrome we always see with the toes, the nerve syndrome? I'm blocking the name.
You could have a couple different places where a nerve's getting compressed, like os trigonum. You could have posterior tibial nerve being compressed in the tunnel there. There's a lot of things you could have. You could have a plantar plate tear, so that's the connective tissue supporting structures of a joint. It could just be run-of-the-mill arthritis. So there's a lot of different diagnoses that you can have. The big key is you got to do imaging with that ultrasound to see what the tissue looks like in real time when you're stressing it. You got to do a physical exam.
So toes are things we deal with all the time. We get a lot of people with bunions. Bunion is just arthritis in the first toe joint, in the great toe. And if people come in and there's some pain, but it's a giant lump, we tell them we can't get rid of the lump. Sometimes the quote lump or the nodes on fingers will actually go away when we inject them. But if you've got a great big bunion, we can often get rid of the pain. But the problem really for that causes it is typically a ligament on the bottom of the foot that is lax, and there's a collapse in the integrity of the foot, so it stresses out that joint. And we inject that, and often the pain can go away. We'll put people on orthotics. Those are little half, how can I describe it? They fit in the shoe, and I've been wearing them. I was a very heavy tennis player for years, and I had the beginning of arthritis in my first great toe. I went to a podiatrist, and he made orthotics for me. I've been wearing them, it's got to be 35 years now, without any pain. So orthotics are important. They have to be made properly to the person's foot. You can't buy them off the shelf. And then the injections will help stabilize that joint and regrow any cartilage that's worn out. The last thing this person talked about, Frida, is left foot pain, which could be from so many different things. And very often it is laxity. It can be from the ligaments around the ankle. And most of these things we can heal up very readily. I had a very good friend of mine who came in. He had clubfoot as a kid and terrible pain his whole life. I did one treatment on his foot, on the medial aspect of his foot, and that pain went away. It's been probably 20 years ago, and he's still, I check with him every once in a while, and that pain has been diminished completely for that time. So, Dr. Grove, let's get back to some science, because people love science. Give us any kind of science about regenerative medicine.
Yeah, so when you're talking about the injury where someone's had pain for a long time, a lot of times there's just an initial injury event, and your body, it's naturally going to heal itself. But sometimes that process isn't as efficient, or you don't get as much healing as you want. So you sometimes can have residual pain from an injury. Now, the way that your body heals is using your own platelets and using your own stem cells So basically how we figured this stuff out is we said, well, these are the cells that heal tissue. How can we harvest these cells? How can we concentrate them? And how do we deliver them to these areas? Because maybe that'll work. So a lot of different papers out there, a lot of different videos you can watch, a lot of different ideas of how this stuff works. But basically, it's basically you're trying to put those platelets in an area that's going to heal. The platelets have a lot of different proteins and different substances inside of them and on the surface of the cell, which are thought to stimulate growth, stimulate proliferation of cells. What platelets don't become is the actual cells that need to be repaired. That's where stem cells come in. So stem cells are thought to do similar things as platelets, in addition to modulating the immune system. So how our body heals is through cells talking to one another. It's called a paracrine effect, meaning one cell talks to another cell, talks to another cell. Common way we think about this is nascent stem cells. So people don't realize we have stem cells all over our body. It's in the tissues, it's in the blood vessels. And so when you do a stem cell treatment, what's thought to happen is the cells you inject also turn on and bring on your body's own healing factors to come to that area. So
yeah, people don't understand this. They come in a lot of times elderly. I'm elderly. I've used stem cells on me. They work. A lot of people come in, they go, my stem cells are too old. Well, it's not true. We all have stem cells all over us. They're all, every person alive has stem cells being released from the bone marrow into the blood system every second of their life. I want to get to Frida because she was hanging on for a while and her call was lost. So Frida, God bless you. How are you doing today?
Thank you very much for taking my call, Dr. Grove. I have sustained a very bad injury on my second toe, on my left foot. I've been to 3 surgeons, podiatrists. They all agree that I have to have surgery. I'm a very anti-medicine person, and I'm very double jointed, and I'm very scared of anything that's out of the ordinary and into just cosmetic stuff going on. I would like to know if I did ask the last surgeon if I could go for what is it called, PRP or stem cell, and they said no, it's not going to help me. Now, unfortunately, I sustained a tear in my second toe on my left foot, and the toe now goes over the big toe, and and I have some pain underneath the feet, and so I don't know what to do. I mean, I do not want to go to surgery, and I would like to know if I could come to see you. Is it going to help me? Is it not going to help me? And also, do you take insurance?
So let me just mention something first before Dr. Grove answers you. This is Dr. Marc Darrow, Frida.
Yes,
insurance is not something we talk about on the show. It's so complex we don't even understand it. So some insurance pays. Generally, regular health insurance does not, but I can't say that's true. But that's typically the case that most of our patients are paying cash, meaning credit card, cash, or whatever it is they want. We also have care credit for people that are low on funds, which is like a credit card that we can help you get. And you don't pay any interest for a year on it. So I'll let you feel the rest of the call about the mechanics of the toe, Dr. Grove.
So for your toe pain, again, it's tough to tell exactly what's going on without looking at you and doing a proper physical exam. But when I hear things like I'm double jointed, that could just be you're a little bit stretchier than the average person, meaning you maybe have a little bit more stretch to your ligaments. So if you say you have a tear, you might have had a supportive structure around the toe called a collateral ligament, which might be torn. That's certainly something that can be addressed with regenerative medicine. How old are you?
I'm 74 and a half.
Yeah,
you're just a baby. I'm 75 and a half.
So you've got, probably some wear and tear going on in that area too. So, wouldn't surprise me if we have a little arthritis going on in that joint as well. But yeah, tough to say without looking at you and doing a proper physical exam, but there's a lot of different causes of pain in that area. Do you know what kind of surgery that they're proposing for you?
Well, first of all, I did fall on a gas pipe that was sticking out of the ground about almost 2 years ago. I didn't see it. I fell on that, and that's what caused the tear in the in my toe. and they were saying that they have to put some kind of a metal in my big toe because I also have bunions. However, the tear needed to be surgically corrected, and I'm scared. I mean, I'm just scared to death.
You know, there was a term, Dr. Grove, that I was fishing for before. It's called Morton's neuroma, and that's something we treat all the time, which is pain on the bottom of the foot where the toe connects to the foot. And I don't know if you have any of that going on, Frida, but that's typically a pretty easy fix to do. Typically, it's not really a Morton's neuroma anyway. That's just a waste paper basket diagnosis that doctors come up with because they touch the area and the person hurts. It's really, it's what I call a metatarsalgia. It's pain in that area from an injury or from overuse or something like that. So again, we'd have to see your foot and we'd have to touch it and find out what is going on. And we don't care about the diagnosis that your surgeon's given you. We don't care that they said you have to have surgery. We have seen way too many people that have finger or toe surgeries that come out way worse. Sometimes they'll put implants in, and we're not for that. So obviously, the byline of medicine, the first thing we learn in medical school is do no harm. And unfortunately, surgery comes out to be harmful in a lot of cases. And I'm one of them. I had a shoulder surgery in my 4th year of medical school. I was very excited to have it. My boss did it for me, and it came out bad. I didn't blame him. It's just what happens. So I think you're pretty smart to be conservative. You know, you always go the conservative route in medicine before you get invasive. And what we do is very conservative. We look with an ultrasound. We take a teeny needle. If it's your toe, it would be a 30-gauge needle, which is like a hair, and inject the area and see if we can get you some healing. So we don't have an answer for you, Frida, today. But if you want to come in, the office number is 800-300-9300. That's 800-300-9300. 9300. You can go to the website www.jointrehab.com. There's photos, or not photos, but videos of us doing these injections, so you can actually see if it's something you want to try, and it might be for you. Any other questions, Frida?
Yes, I thank you very much. I'm probably going to recommend you to a very close friend of mine who was suggested to have immediate surgery in her shoulder. So
why immediate? What's the immediacy about?
Well, she's already scheduled for May, I guess, for May 25th or something to go. And I'm going to talk to her about you and give your telephone number and also all the information that I have heard from you for today.
Wonderful.
And let her make a decision.
It's always good to get a point of view, you know, that's different, something out of the traditional box. Because traditional medicine, like I always say, is a dinosaur. It's shifting. People are getting too smart to get medicated with things they don't need or to have surgery on things they don't need. And
correct.
Look, we love the surgeons. My gosh, that's the hardest work in medicine is doing surgery. But we don't like the surgeries in most cases. There's correct. A lot of surgeries that have to be done. You break a leg and the bone is sticking out, you better have surgery right away. But I'm curious about this, Frida. You said that your friend needs immediate surgery on the shoulder. What is immediate?
But then you've got a surgery scheduled a month out. It doesn't sound very immediate.
No, but this is a different question, Dr. Grove. What's the immediacy? Why does it have to be immediate? Why does it have to be at all?
Well, I did not question her. Okay. All I know is that they did one surgery on one shoulder, and now she needs the second surgery on her other shoulder. Okay. And I told her not to do it until she seeked, more information about alternative medicine.
Yeah. Well, let me query one word you said: needs. There's no needs when it comes to surgery unless it's some type of an emergency where you're going to get infected, or you're going to bleed out, or something like that.
Yeah.
So,
well, your immediate is very different, very scientifically different than just lay people like myself, who we are not I mean, I'm a doctor in psychology, but I don't know anything about medicine,
Yeah.
science medicine. So it's just that for me, it is immediate when you're saying, I have to go because I can't move my arm. I have pain.
No, there's no reason to have surgery because you can't move your arm.
There's a really big between you need to have something done versus you're doing an elective procedure. Like Doc said, there's a lot of conditions where you need to have surgery, as soon as possible, right? Things like big traumas, you're bleeding out, there's a nerve being damaged, you're in a car accident, things like that. But most surgeries that we do in the United States are not emergent. They're elective, meaning you can choose if you want to have the surgery.
And the most important thing with that, Dr. Grove and Frida, is elective means the patient gets to decide, not the surgeon. Elective means you don't have to do it.
Correct. Yes.
And as a patient, it's important to gather information and try to get education. That's our whole initial consult that we have together, is just trying to put information together. I never push anybody that you need to have regenerative medicine treatment, you need to have surgery. Make an informed decision, know the risks and the benefits, and make the decision on your own. But we'll never make anybody do anything.
No, that's the good thing about it, because yes, we live in the United States of America, and we're very grateful. I am very grateful myself for having you and other very conscientious doctors who are not in a rush just to do what they were trying to do. I'm a big believer in God and healing, and good doctors like you who are helping people to live longer without pain or minimum pain, rather than just going and suffering. Because my daughter just last year had a very big surgery on a meniscus tear, which now she regrets, and we didn't know about other treatments. But more than half of her meniscus was taken out, and she's still in therapy.
Horrible. That's horrible.
And
yeah, we see it all the time. You know what I hear from I have a lot of orthopedic surgery friends, okay? And what I hear from them all the time is we have to get in there right away and clean that out, or you'll have arthritis. Well, what they do gives immediate arthritis by its nature. You're destabilizing the joint. You're taking out the integrity immediately. So that's arthritis right there.
Yeah.
And then
even when you're putting your scope in to look, right? If you just do we're just going to clean some things up, clean out scar tissue. That's a common procedure all your patients get. When you put those scopes into the knee, a lot of times you're doing what we call iatrogenic injury, meaning you're unknowingly damaging that healthy cartilage that's in there. So when you have surgeries like this, you're, like Doc said, destabilizing, creating more damage. A lot of times that's going to speed up that degeneration of the joint.
So do you would you suggest for her to have PRP or stem cell at this point?
Absolutely. Absolutely 100%. That's without even seeing her, based on what you're telling me. Because what we can do is regrow some of that tissue and create a distance between the bones that's been taken away. That meniscus was very valuable, torn or not. I guess that's the end of the show. That's a little early. What's up?
This is about the time we have to get going, and
all right.
Thank everybody.
Well, I'm going to give out the phone number to my office. Dr. Grove and I would be happy to see you. Give the office a call at 800-300-9300. Write this down, 800-300-9300. And go to the website, www.jointrehab.com, and you can email us through that site.
Thank you. See you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab and sports medical center experts for free, and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.